Less
Thanks,
than
Laura.
2 weeks out from the Tasmanian election, Labor is attempting to regain the momentum with a focus on one of its preferred policies, and that is healthcare. The Liberal government is standing out on its record, but a familiar face from their ranks is calling out her former colleagues. Political reporter Tom Connell filed this report from Hobart.
On a cold day outside Hobart Hospital, Labor was concerned what was going on inside.
40 beds could be opened today, right now, if the government would just be opening the doors.
Ward 5A is not just closed but padlocked. However, the ward isn't closed, it's been moved as part of the hospital's redevelopment.
Labor had been caught red-handed trying to deceive Tasmanians. Previous Ward 5A has transitioned into the new K block and in fact additional surgical beds have been added as well.
So, how many new beds have been added to capacity?
I'd need to seek that answer.
The question is a tricky one because healthcare in Tasmania is facing a crisis. 12,000 people are stuck on surgery waiting lists and emergency departments are often unable to cope. The latest, this 87-year-old man with pneumonia forced to wait on a plastic chair in Launceston for 9 hours.
Look, was disappointing to read that, but EDs will triage people appropriately as they see fit.
I cannot imagine what it means to the patient.
Labor has been trying to make health a central issue in this campaign, pledging to outspend the Liberal Party by hundreds of millions of dollars. It also wants to spend bigger on helping the economy recover from COVID. And with neither of the two sides pledging any more taxes or savings, it all essentially gets added onto net debt.
Labor will need to, if they were to take government, either increase taxes or sell assets.
We will be able to fund our promises and still return the budget to surplus within the first term of a majority Labor government.
Voters are unlikely to mark Labor down for pledging to spend more money, considering the state is still in a pandemic. But getting voters to change jockeys mid-COVID has so far proved elusive elsewhere in Australia.
So this isn't necessarily a COVID election, it's an election on the government's last 7 years, not just the last 7 months.
There is at least some baggage for the Liberal Party. Defected Liberal MP Sue Hickey running as an independent.
Now, they kept me in the party for their own reasons. I was the number 13th, so by keeping majority government, they held on to me. When it no longer suited them and they wanted to go to a dud election, they decided to get rid of me.
Tom Connell, Sky News, Hobart.
And don't miss the Sky News Mercury People's Forum on Monday the 26th of April when Premier Peter Gutwein and the opposition leader Rebecca White take questions from undecided voters. That's just 5 days out from the election there. Don't miss a thing.